So you talk to the patient, you've decided you're going to get a patellofemoral replacement, and now what do you do next? So you got to make sure that you have the right numbers. Again, there is some data on this, but the literature is just sort of relatively sparse. There's different types of implants that you can use, but really you want to make sure that you have some understanding. So I'll give you sort of my tips as a patellofemoral surgeon on what I think about. So most patients, there's sort of these three categories of patients. There's the female patients that have chronic dislocation, and it can be males, but it's much more commonly females. Those patients are difficult. You got to be careful with those because generally they come in, either they're pretty gone or their patellas are so deformed. These are the ones you really want someone that knows what they're doing, because the patellas can be really thin and there is a risk of fracture if you do this surgery. So you want to make sure you understand the thickness and all those things. And that's why preoperative planning MRIs are important. The second is people that have isolated arthritis. Now this can be males or females, still more likely in females. And then the third are the male patients, that sort of high level athlete, kind of worn down. Now again, the rest of the knee is good. So these are kind of your three categories of patients that you want to think about.